Well, programs like the ones you saw in Dan's report sometimes fall under the Supplemental Nutrition Assistance Program, or SNAP. Now, formerly known as food stamps, SNAP offers nutrition assistance to millions of low-income individuals and families and provides economic benefits to communities. Now, the program benefited over 44 million Americans just last year alone. On average, an individual receives roughly $125 in food assistance per month. Well, a recent study by the U.S. Department of Agriculture shows how important well-designed nutrition programs can be. The research showed that children participating in nutrition education programs increase their daily fruit and vegetable intake at home by 1/4 to 1/3 of a cup. Well, for more on the importance of having access to healthy food options and the role of nutrition education programs, I spoke with Parke Wilde. He's a professor at Tufts University's Friedman School of Nutrition Science and Policy. I began by asking how nutrition factors into these programs.
Nutrition and hunger have always been side by side as the goals. But there's other federal nutrition assistance programs that have always had a special focus on nutrition, such as the WIC program for women, infants, and children. And so SNAP, because of its central role in preventing hunger, people have been a little more careful not to mess with it, not to target it too closely, to make sure that it's respectful of people's own autonomy to make their own choices.
So then for people who are trying to understand the connection, is it really as simple as saying if you have access to healthy fruits and vegetables, regardless of how far away you are, that will necessarily translate into healthier eating? And if so, what happens when the prices go up?
I think that's a really interesting question. There's sometimes the case for locating supermarkets in new locations can be overstated, as if all one needs is the supermarket in the right place and then people are going to buy a lot of fruits and vegetables. But some of the other considerations that you just mentioned, I think, are central. So you really have to think at the same time about access to the retailers, but also about purchasing power and people's own desires and education, considering what it is they'd like to buy.
Now let's also look at subsidizing. We know that the government already subsidizes heavily things like milk, corn, and rice. Do you expect to see any sort of similar aspects when it comes to healthy fruits and vegetables?
Even the fruit and vegetable industry doesn't actually ask all that much for traditional subsidies. If you think of the subsidies that currently exist for corn and soybeans and cotton, fruit and vegetable lobbying organizations tend not to ask for those, but they do like the federal government's support on certain key things, such as research, both on production, but also even on clever new technologies that make it easier for consumers to enjoy fruits and vegetables, especially to make them more shelf-stable, less perishable, but also to promote awareness of fruits and vegetables through things like fruit and vegetable programs, through school meals and opportunities like that to encourage and to change people's tastes and preferences in the direction of fruits and vegetables.
So then what would be some of the pros and cons then of subsidizing healthy fruits and vegetables, since that's not something that some of these lobbies are really pushing for?
I think that on the upside is that it would encourage increased consumption. And we really, I think it's important not to overstate as if this is some type of magic pill, but people really do respond at the margin to prices, and so that could make a difference. On the downside, one has to mention the expense for a national subsidy, and also the sense that the traditional row crop subsidies have been a mixed bag in terms of their public policy success, and so adding a new one isn't the only thing on people's minds. There may be, that's just sort of one tool in the arsenal that could be applied to this problem.
So then when you look at some of the funding from the prevention standpoint of trying to encourage people at the beginning stages to eat healthier versus some of the long-term detrimental effects we can see that then trickle into healthcare expenditures, what do you think will be the tipping point then that would perhaps have more of the focus on the funding at the prevention stage rather than the cure and management stage?
The turning point really could be when a number of things change at the same time. If you see sort of improvement on the prices, if you also see children as they become youth and early adults having been exposed to more fruits and vegetables through school meals programs, if you think about public campaigns like Fruits and Vegetables More Matters or other advertising for fruits and vegetables that helps compete with the heavy advertising for quick service restaurant meals or for sugar sweetened beverages, I think to have several of these change at once might be the turning point. And it's an important issue, as you mentioned, because of the high cost, both in terms of the pain of chronic disease, but also even the financial cost of chronic disease at a time when the country's struggling a lot with, paying for healthcare. And so perhaps that tipping point is coming soon.